Good afternoon. Please have a seat. As Ray Charles said, it's time to hit the road, Jack, and welcome to the new and improved ASM of the Immunisation Coalition. You'll note that we're starting at 3 o'clock rather than the traditional 5 o'clock, and that's a reflection of the high quality and number of presentations we'll have this afternoon. So, to start with, I'd like to acknowledgement of country. I'd like to pay our respects to the traditional custodians of the land, to elders past, present and future, particularly the Wurundjeri people of the Melbourne area. And I would like to also celebrate the diversity of Aboriginal peoples and their ongoing cultures and various connections to the lands and waters of Australia. I'd also like to acknowledge the people who've made this event possible, particularly members of the Immunisation Coalition Scientific Advisory Committee and IC staff. There's taken about 500 hours of people time to achieve this to date. Now, to start with, we have a number of welcomes, and I think this is a first, and I'm looking to our official historian, Alan Hampson, but we actually have a welcome from the Chief Health Officer of Victoria, Dr. Carolyn McElney. So, Carolyn, if you're able to come up for us. And as Carolyn's coming up, I'll just highlight that Carolyn was Director of Public Health in New Zealand during the pandemic, so she's got an enormous amount of experience of public health and immunisation.
Thank you. Thank you, and good afternoon, everyone. I wasn't aware that I was the first Chief Health Officer to have come along and speak at your meeting. I'm delighted to be here. Before I start, I too just want to acknowledge the traditional owners of the lands on which we're meeting and pay my respects to elders past and present. I've been the Chief Health Officer here for 6 months, so I still feel quite new, and I'm still particularly trying to work out what happens at a state level in immunisation and at the Commonwealth level. I've had many years of work, experience, practice, challenges in the field of immunisation in New Zealand, delivering and designing immunisation programs. And I would like to thank the Coalition for your significant contribution to developing resources that support vaccine uptake and for providing clinicians with evidence-based information on this critical public health initiative. Staying informed about emerging evidence and developments is essential for all health professionals, and this annual scientific meeting continues to strengthen capacity and knowledge across the sector. Immunisation is a cornerstone of our health protection efforts, and it is one of the reasons in my career in public health, immunisation has always come up at some point in some way. And at the Department of Health, we are continually looking for ways to support access to and uptake of vaccinations on the National Immunisation Programme, as well as state-funded vaccines, to help us achieve our goal of ensuring Victorians are the healthiest people, with equity central to that mission. Like the rest of the country and the world, Victoria is navigating a shifting and challenging immunisation landscape, much of which you'll be hearing about over the next 2 days. Ensuring our communities have high levels of trust in immunisation programs, in our health systems, and in you, our health professionals, is essential to maintaining strong uptake. We are fortunate in Victoria to have a strong foundation with generally high childhood immunisation rates. though we have seen some recent declines. This is concerning, particularly because some diseases, such as measles, require very high coverage to prevent outbreaks. And we in Victoria alone this year have had 8, possibly 9, I think one came in on Friday, measles cases already this year, 7 of which were acquired overseas. And basically it is the high level of community protection that has prevented more widespread transmission. I have worked in places with low MMR coverage where the response to a measles case is significant because we know that we don't have that protection in the community. That has been one of my observations in the 6 months that I've been here, is that sense of security that you have by knowing that your coverage rates are high. So we remain vigilant and rely on your support to maintain high MMR coverage across children, young people and adults. Most of our cases that were reported were adults. Victoria has also demonstrated the ability to respond quickly to emerging vaccine-preventable threats, and our rapid public health responses to Mpox, Japanese encephalitis and RSV in recent years show the strength, capability and agility of our system. A key priority in our immunisation programme, as it is across the country, is achieving equity and supporting Aboriginal and Torres Strait Islander communities remains fundamental to that approach. We continue to work in partnership with Aboriginal community-controlled organisations to develop and lead culturally safe vaccination initiatives which improve access, strengthen community-led delivery and help address persistent coverage gaps. In closing, Victoria remains committed to working collaboratively to ensure every person, regardless of age, background or location, can access safe, effective and timely vaccination. Thank you again to the Immunisation Coalition for convening this forum and for your ongoing leadership. I wish you all the very best for this 27th annual scientific meeting. Thank you.
Carolyn, thank you. Our next welcome is a letter, and there's a copy on the tables from Senator Anne Ruston, who's the Shadow Minister for Health and Aged Services, and it's a very positive and helpful letter, and I'll just summarise the point, but she apologises for not being able to attend today. She acknowledges the importance of our work, and she makes the point that prevention is a very important part of healthcare, and she wishes us well. So again, thank you to Senator Ruston, and hopefully she can help advocate for groups like us in terms of resources and access to programs. Our third welcome is from Professor Michael Kidd, and Michael sent a video which we'll show now. Michael is the Commonwealth Chief Medical Officer.
Able to join you in Melbourne for the 27th annual scientific meeting of the Immunisation Coalition. But I want to thank you all for your contributions to advancing the importance of immunisation to the people of Australia. As you all know, immunisation remains one of the most powerful tools that we have to protect the health of individuals and the health of our population. At a time of increasing global mobility, emerging and re-emerging infectious diseases, and ongoing challenges with vaccine confidence and hesitancy, your work has never been more important. Your contributions to science, to policy, and to clinical practice continue to save lives every day. You also know that we can't take high coverage for granted. In Australia, childhood vaccination coverage has continued to drift downwards since the COVID-19 pandemic. Interim analysis of Australian immunisation register data for 2024 showed that fully vaccinated coverage in that year fell to 91.6% at age 12 months, 89.4% at age 24 months, and 92.7% at age 5 years, below the 95% target that helps to protect our communities from outbreaks. This pattern is being mirrored globally. In 2024, it is estimated that 14.3 million children have missed out on any vaccinations, the so-called zero-dose children, and measles first dose coverage sat at 84%, leaving serious immunity gaps and the risk of serious measles outbreaks. One driver of these changes is information. Misinformation can spread through confusion or misunderstanding, and deliberate disinformation, manipulated information that is knowingly false and intended to deceive and cause harm, both actively erode trust. And that's why rebuilding confidence needs to be a shared effort, and it's a top priority for me as the nation's Chief Medical Officer. Backing in our nation's trusted vaccinators, equipping our nation's nurses and general practitioners and pharmacists for conversations with people who are uncertain, ensuring timely, accessible public information is available. To my clinical colleagues, never underestimate the profound impact that you can have supporting decision-making by those people who trust you for their medical care and advice. All these actions sit at the heart of Australia's National Immunisation Strategy, which places building trust and acceptance at the centre of improving uptake rates. We're at a significant moment for public health in Australia with the establishment of our National Centre for Disease Control, our ACDC, which formally commenced operations on the 1st of January. Our Australian CDC brings together world-class disease surveillance, expert analysis, independent, evidence-formed advice, and clear public information to better prevent, detect, and respond to communicable diseases and other health threats affecting our country. Our CDC will strengthen national coordination, support modern surveillance systems, and help to guide the implementation of important aspects of Australia's National Immunisation Strategy, all of which will enhance our ability to protect individuals and communities, inform public policy, and support our preparations for future outbreaks and emergencies. The collaborative, data-driven approach of our CDC will support faster, more effective public health action and a healthier Australian population. Today's meeting provides a valuable opportunity to share evidence, challenge thinking, and collaborate across professional disciplines, from research and clinical practice to policy and community engagement. Thank you all for your commitment to immunisation and to public health. The next few years will continue to be challenging, but by working together towards the common goal of protecting Australians against infectious disease through immunisation, and by strengthening confidence in trusted evidence, we can continue to reduce the risk of infections and prevent avoidable harm. Thank you all. Hello, everybody.
Done. So, thank you to Carolyn, Andrew, and Anne and Michael. And just before we start, please make sure that your phones are switched off. Please be encouraged to ask questions and make comments. Remember, we're a very multidisciplinary group, and inputs from different sources and viewpoints are what makes this meeting so enjoyable. If you've got dietary requirements, you'll have a little card. Please have that displayed for when dinner is served at 6:30. Please, enjoy the next 9 talks. We won't go through the bios, they're on the information you've got. And finally, I just want to highlight and thank our sponsors, Sanofi, GSK, Pfizer, CSL Seqirus, Moderna, MSD, BioSelect and AstraZeneca. So, time to start.